guys, I'm Shelby Laubach, and this is my history and focus assessment number 4. At this point, I have already washed my hands, I've introduced myself to the patient, and we're going to go ahead and get started with our interview portion. So Connor, what brings you in today?
I have a mild cough.
You have a mild cough. And when did this cough start?
About 2-3 weeks ago.
Okay, and did it come on all of a sudden, or has it gradually come on?
It was just kind of all of a sudden.
All of a sudden. Do you feel like it's progressively gotten worse at all?
No.
No, it's just kind of stayed the same?
Yes.
Okay, and tell me about this cough. How would you describe it? Is it like a dry cough, a moist cough? Does anything come up when you cough?
It's just a dry cough, nothing comes up.
Okay, and what about anything else with your throat? Have you had like a itchy, scratchy throat at all? Has it been sore?
It's just been kind of itchy.
Just been kind of itchy.
Mm-hmm.
And this cough, you said it kind of came on like 2 to 3 weeks ago.
Mm-hmm.
Is it constant? Is it every day? How would you describe?
I would describe it every day.
It's every day.
Mm-hmm.
Does it disturb like your sleep or at work?
No, it doesn't disturb anything like that.
Okay. Do you have any shortness of breath or chest pain, chest tightening? How about any fevers?
No, none of the above.
None of that. Okay. Have you tried to do anything to relieve this cough, like cough drops or a diffuser or any over-the-counter medications, prescription medications, maybe anything that helps relieve the cough?
My wife uses a diffuser at night, but I mostly have just been drinking more water.
Okay. And do you feel like the water helps when you drink water?
More or less.
Okay. And how about, do you have any history of like any pulmonary lung injury or trauma or any nasal trauma at all?
No.
Have you had any nasal congestion?
I have had nasal congestion.
Okay. Does anything come out?
No, nothing comes out.
Okay. And does that come and go as well?
Yeah, but it's mostly persistent in like the morning.
In the morning time. All right. And do you take any prescription medications regularly?
No.
No. Do you have any cardiac issues, cancer, any other disorders?
No.
Do you have any medical issues at all?
No.
Okay, so you've never had any like pulmonary issues such as like asthma or cystic fibrosis, COPD? Anything?
No.
Nothing.
No.
Okay. All right. And what about family history? Do you have a family history of any pulmonary issues at all?
Dad has allergies, and I think my aunt has asthma.
Has asthma. Okay. And do you know what kind of allergies your dad has?
Seasonal or kind of environmental.
Okay. And have you ever been tested for any allergies yourself?
No, I have not.
No allergy testing. What about any like pulmonary function testing or tuberculosis testing?
No.
No. Okay. And you said you don't take any medications regularly.
No.
Are you up to date on your vaccinations, such as like influenza, your COVID, maybe pneumonia?
Yes, I'm up to date on all my shots.
All of them. Okay. And do you have any family history of cancer at all?
No.
No. All right. And tell me what you do for work.
I'm an industrial air compressor technician.
Okay. And does that involve being around a lot of like hazardous things or chemicals?
Mostly just large amounts of dust.
Large amounts of dust. And do you wear a mask or anything while you're at work?
No.
No.
No, not as often as I should.
Okay. And do you find that when you're around dust at work, does the cough seem to be worse?
Yeah, it's a little bit worse. Throat's a little bit scratchier.
Okay. And tell me about like your living environment, where you live.
I am tucked away back in the woods.
In the woods. Okay. And at home, do you use like any humidifiers or anything inside the house?
No humidifiers. My wife uses a diffuser from time to time, mostly at night.
Okay. And what about any tobacco use?
No.
Any alcohol use, illicit drug use?
No.
Are you exposed to any secondhand smoke at all?
No.
Okay. Have you been around anybody who's been sick recently?
Not to the best of my knowledge.
Okay. And have you done any travel in or out of the country at all?
No.
No. Okay. Okay. well, then with that, I think I'm going to go ahead and proceed to our physical assessment if you're okay with that.
Okay.
Okay, I'm going to have you, for our pulmonary exam, I'm going to have you remove your shirt if that's all right.
Yeah.
And first, what I'm going to start out with, I just want to inspect your chest. So I'm just going to look at the front here. I don't notice any color abnormalities. I don't notice any deformity, bulges. It doesn't look like you're working to breathe at all. I don't hear any audible stridor or wheezing. And I also don't see any like cyanosis around your lips. You look very comfortable, very relaxed, no nasal flaring, no retractions. I'm gonna have you, I just want you to stick your fingers together and press them together there. Good, I see a little diamond. I'm just looking for clubbing. You don't have any, so that's great. And I'm gonna have you just turn to your side here too. I'm gonna look at the back as well. I also do not see any color discrepancies, no bulges, masses, no deformity at all. Okay, you can turn back to the front here. And I'm just going to go ahead, I'm going to palpate, and I want you to tell me if you feel any discomfort, tenderness, anything where I'm pressing, okay?
Okay.
I'm going to start up in your trachea area here. Just going to palpate. Any tenderness there?
No.
Okay. And we're just going to kind of come under your collarbones and all throughout your chest. Do you feel any, don't feel any lumps or masses, any tenderness at all?
No.
Okay. Good. Don't feel anything. Okay, I'm going to have you turn to your back again. Thank you. We're just going to feel back here. Any tenderness when I'm pressing?
No.
Okay. All right, I don't feel any masses, lumps, bumps. I'm going to have you, can you go ahead and say the word 99 for me?
99.
Good. And one more time.
99.
Good. So for tactile fremitus, I can feel the fremitus, but it's not increased, it's not decreased. It feels normal. I'm gonna put my hand on your lower part of your back right here, and you're gonna feel me thump my hand, and I want you to tell me if you feel any pain, okay?
Okay.
Anything?
No.
Okay. And on the other side?
No.
Good. Just checking for CVA tenderness. It is negative, so that's great. No pain at all when I was pressing here.
No.
Okay. And so while I'm here, I'm going to go ahead and just percuss down your back. So I'm going to be measuring that diaphragmatic excursion. What I want you to do is cross your arms in front of your chest and kind of lean forward a little bit, like bad posture. Just drop. There you go. Perfect. Relax your shoulders. And I'm just going to percuss down. Okay, and I'm going to mark that spot. I'm going to percuss back up. Good. So we have a mark on that side. We're going to mark down this side. Good. I'm going to go back up. Good. And any pain when I do that?
No.
Okay. So measuring for diaphragmatic excursion, I would say they're about 4 to 5 centimeters on both sides. So that's great. And I have you turn back to the front here. And I'm just going to listen to your lungs. I'm also going to listen to your heart. So I'm going to listen to your heart first.
Okay.
Good. And I can hear S1 and S2. I do not hear any extra sounds, so that's good. And then I'm going to go ahead and listen to your lungs here. So you take a deep breath for me. Very good. Okay, and then I'm going to have you turn to the back, and I'm going to listen on the back here. Take a deep breath. Good. Good. Very good. Good. Your lungs sound clear. I don't hear any stridor, crackles, rhonchi, nothing. I don't hear any extra sounds. Everything sounds nice and clear in all of the areas of the lungs, and the bases of the lungs sound clear. I don't hear any fluid. I don't see any edema or swelling. So I'm going to have you can go ahead and put your shirt back on. So from my assessment that we've done of your pulmonary system, both in the interview process and in this physical examination, it would seem to me that you're experiencing some environmental allergies related to maybe the dust that you have at work or living out in the woods. It's pretty common this time of year in the springtime. So what you can do, you can try some over-the-counter medications if you would like to. We can maybe try like some Claritin D or some Zyrtec. You can try like some nasal rinses for your nose when you feel that congestion in your nose. And then if you would be interested, we could maybe even set you up for some allergy testing too if you wanted to see exactly what is your triggers.
Okay.
Does that sound okay?
Yeah, that sounds great.
Okay. So with that ends this assessment.